So good afternoon, everyone, and I'm proud to be standing with my colleagues and partners on the Right to Contraception Act with Senator Hirono and Congresswomen Fletcher and Williams and Jacobs and Clark. And thank you to the tremendous partners here today who are fighting for reproductive justice and freedom each and every day. To Dr. Reagan McDonald Mosley, CEO of Power to Decide. Claire Coleman, President and CEO of National Family Planning and Reproductive Health Association. To Mini Timaraju, President of Reproductive Freedom for All, and Gretchen Borchelt, Vice President for Reproductive Rights and Health at the National Women's Law Center. We are facing unprecedented, unconstitutional attacks on American healthcare. Donald Trump and Elon Musk are raiding federal coffers that help fund community health centers, health clinics, hospitals, and health providers. They are freezing federal health care communication and sending intimidating and dystopian messages to researchers and providers, threatening to withhold funding for analyzing gender and race. Just last week, the Centers for Disease Control and Prevention, the CDC, website on contraception was taken down, only to be replaced by text that reads, quote, CDC's website is being modified to comply with President Trump's executive order. This is a systemic attack, and reproductive justice, including contraception, is and always has been on the chopping block. It is the canary in the coal mine for healthcare for every American. It is a preview of coming atrocities that they are going to seek to perpetrate on the healthcare of women in our country. And the chaos that Donald Trump and Elon Musk create will only fuel Republican efforts to slash Medicaid, gut the Affordable Care Act, and sell out Americans' healthcare for billionaire tax breaks. Every cut we make to Medicaid, every hole we put in the Affordable Care Act coverage, every dollar lost in funding to health providers and health centers will translate to people having a harder time to get birth control. It will make it even harder to find a doctor, require more insurance, red tape to sift through, and force people to pay more out of pocket. Now is the moment to make clear not only what we are against, but what we are fighting for. And that is why we are reintroducing the Right to Contraception Act. The Right to Contraception Act guarantees Americans have the freedom to get contraception and for health providers to give it. The right to contraception free from federal and state government threats, and the dignity to choose what contraception works best for them and for their families. The Right to Contraception Act is about standing for freedom and choice for every American, Black, brown, immigrant, LGBTQ, disabled, rural, and low income. It is about guaranteeing that every American can get the care they need and when they need it. Republicans have and will continue to oppose health care freedom. Last year, the Senate voted on the Right to Contraception Act, and Republicans ensured it did not pass. The year before, in 2023, we tried to pass the bill, and the Republicans blocked it. And in 2022, we tried to pass the bill in the Senate, and the Republicans blocked it. All the while, Republicans have engaged in systemic campaign to peel back the right to contraception. In Dobbs, the Supreme Court decision repealing the constitutional right to an abortion, Justice Clarence Thomas called into question Americans' right to contraception. Across the country, state legislators and Republican governors are peeling back insurance coverage of Plan B, blocking health clinics from providing contraception, and vetoing state versions of the Right to Contraception Act. And Project 2025, the outline of the Trump-Musk agenda, detailed a vision of America that excludes birth control from insurance coverage and rips funding from the very health clinics that help people get the contraception which they need. Donald Trump, Elon Musk, and the Republican Party have shown us over and over again the attacks on contraception aren't hypothetical. They are real. The all-out onslaught on healthcare and on democracy itself has made this fight harder, And the harder the fight, the more important it is that we take it on. That's what we're announcing today. The details are long, but the story is short. Republicans are fighting on behalf of their billionaire buddies to make it harder for Americans to get health care. We are fighting for guaranteed health care for everyone, and that will always include reproductive care. Republicans may be willing to sell American rights away, but we are not. And that is what we are announcing today, and it's my honor to introduce the great Congresswoman from Houston, Texas, Lizzie Fletcher.
Thank you so much, Senator Markey, and thank you to all of our colleagues who are gathered here today. Thank you to everyone who's here today for your work and your partnership in this important effort to protect and assure that all Americans have the right to contraception of their choosing. I'm so glad to work with you on this, Senator Markey, and so proud to lead this legislative effort in the House. 200 members of the House of Representatives have signed on as original co-sponsors of this bill, which we filed in the House this morning, the Right to Contraception Act. And that includes, of course, my co-lead sponsors, Representative Sarah Jacobs, who's here, who you'll hear from shortly, as well as Representatives Nikema Williams and Angie Craig. I also want to acknowledge and thank our former colleague, Kathy Manning from North Carolina, the original House sponsor of the Right to Contraception Act, for her work on this legislation and her leadership on this issue. As Senator Markey made plain, this legislation responds to a real threat to our freedom and to our families, and we need to take it seriously. In my home state of Texas and in states across the country, women and families are in crisis because of increasing restrictions on their ability to access reproductive health care of all kinds. And so many people here in Washington and across the country are working to change that, are fighting back. And I want to take a minute to just thank a few of them now who are here with us today. Of course, in addition to Senator Markey, co-lead Senator Hirono and Senator Duckworth, House Democratic Whip Katherine Clark, who will be here shortly, as well as our Reproductive Freedom Caucus co-chairs Diana DeGette and Ayanna Presley. My fellow Texan and fearless advocate, Minnie Timaraju, President of Reproductive Freedom for All, as well as Gretchen Borchelt, Vice President for Reproductive Rights and Health at the National Women's Law Center, Dr. Reagan McDonald Mosley, CEO of Power to Decide, and Claire Coleman, President and CEO of National Family Planning and Reproductive Health Association. I also want to thank the many, many organizations that have offered their support for this legislation, that have mobilized people to sign on to this bill and to make sure that we continue this fight. And I think it's really important to know and remember that, for years, Democrats have been warning, and I personally have been warning, I think probably everybody standing up here has been warning people that if given the opportunity, Republicans would do everything they could to overturn Roe v. Wade. And for years, people said they just didn't believe it would happen. It couldn't happen. It was the law of the land. There's no way. We could not be right. Well, we all know what happened. We all know that the Supreme Court overturned Roe in the Dobbs decision in 2022. So today, when we warn you that Donald Trump and congressional Republicans and Republicans across the country and legislatures across the country are taking steps to overturn not only the right to access abortion care and to access abortion, they are also undermining the very framework that protects reproductive freedom more broadly, as Senator Markey explained. They're undermining and attacking the right to privacy, the right to make our own decisions about our bodies, our families, and our futures. And people must listen now. As Senator Markey said in his concurring opinion in the Dobbs decision, Justice Thomas said that the Supreme Court should reconsider its decisions protecting fundamental rights, including the right to use birth control that was set out in Griswold versus Connecticut. As I think probably everybody here knows, but needs to know, Griswold established the right for married people to use contraception. He said we should take another look at that. I think it's really important for people across the country to understand that, because people across the country rely on birth control of all kinds to plan their lives and their families. And this concept of having the privacy and the right to make those decisions about whether and when to have a family is something that people across our country have experienced for more than 60 years. But now extreme Republican lawmakers across the country are attacking the right to use birth control of all kinds, and they are preventing access to basic reproductive health care to get it. They're conflating birth control with abortion for the purpose of restricting access to both. And so it's really important that by enshrining the right to contraception into federal law, we would reverse the steps that Republicans have taken in states across our country to restrict access to birth control. States like mine, Texas is ground zero for restrictions and attacks on reproductive health. And I have witnessed the danger and devastation that the restrictive laws in our state have caused. And these laws, to be clear, are a blueprint for other states across the country. It's important to pay attention not only to what we're saying, but to what we're seeing in Texas. Texas, for example, is one of 7 states that allows pharmacists to refuse to fill prescriptions for birth control because of their own personal beliefs. And Texas is one of 24 states that restricts a minor's ability to obtain contraception without parental consent. That's why this legislation is important, because these restrictions aren't just empty threats, they're real for women and families everywhere. The Right to Contraception Act responds to this, and it responds to the very real threats to reproductive health care and bodily autonomy that we face today. It doesn't matter to President Trump and congressional Republicans that Americans overwhelmingly support access to birth control. 8 in 10 Americans support the Right to Contraception Act across demographic lines and party lines. But the efforts to restrict access to birth control are not about reflecting the will of the people. They're about taking away the freedom and dignity and autonomy of all Americans. Democrats in Congress will continue to lead and support legislation to protect the health, dignity, freedom, privacy, and autonomy of women and families across our country. We will not give up. So again, I'm glad to be here with leaders in this fight today and to turn the program over now to one of them, Senator Mazie Hirono.
Thank you. I'm so glad to be here with my colleagues in the House as well as in the Senate to call attention to the fact that this is a very real danger, the elimination of the right to have contraception. So millions of people in our country rely on contraception, but the Trump administration, their unrelenting desire to limit our access to reproductive health care continues. And as already mentioned by my colleagues, that there are states also that are limiting access to contraception, access to for minors. All of this is going on. This is a bill that would preempt these kinds of attempts at limiting our right, a basic right to access contraception. And I just want to mention that there are doctors all across our country who rely on guidance on what would be appropriate contraception to provide for their patients. And I can tell you this only represents hundreds of pages of guidance. This one is entitled U.S. Selected Practice Recommendations for Contraceptive Use 2024. This one is entitled U.S. Medical Eligibility Criteria for Contraceptive Use 2024. Hundreds of pages of guidance that doctors refer to every single day so that they are providing and prescribing the appropriate contraception for their patients. All of these pages have been totally eliminated. Totally eliminated. Get that into our brains. This is how far this administration will go. Now I hold up a chart. This is a summary chart of what doctors refer to for the same thing. Like, what is an appropriate contraception to give to somebody who's maybe diabetic or other kinds of conditions that are getting treated for cancer? Gone. This is real. This attempt to make it that much harder for people to have access. And by the way, this bill does not require anybody to prescribe contraceptives. It doesn't require anybody to take contraceptives, even if Republicans are saying that's what this bill does. They're really good at framing the bills like this in ways that is not in the bill. I mean, it would be helpful if they actually read the legislation, but sometimes even when they read the legislation, they come out and say the opposite. So I could go on, but I think it's really important that CDC is being told to eliminate all of these guidance while they fool around with what doctors should have available to them so that they make the right decisions. I am among those who for years have said that these assaults on our right to control our own bodies, that one day women in our country are going to wake up and know that we no longer control our bodies. So that day has come because we have an out-of-control Supreme Court that brought us the Dobbs decision. And they're not done. As mentioned, we have one justice who has signaled, that's what it's called, signaled, that maybe he wants to revisit the Griswold decision that enabled contraception to be allowable. In that case, it was for married couples, but you know what? It should be for all of us. And he has signaled that he would like to revisit that decision. So this is a wake-up call for all of us. We need to continue to fight back so we have control over our own bodies. So I'm glad to be here with all of you.
Fabulous. Thank you. And next, we're going to hear from House Democratic Whip from the great state of Massachusetts, Katherine Clark.
Thank you so much. Thank you. I am so proud to be here with Senator Markey, who is one of my very favorite constituents. And so grateful to Congresswoman Fletcher and Jacobs and Senator Hirono for your work and for bringing us this bill and letting me be here today to talk about it. As everyone has set forth, this bill, the Right to Contraception Act, is about as clear-cut as it gets. It's about health, it's about freedom, and it's about dignity. It is about having autonomy over your own body and decisions and making sure that when you are having discussions with your doctor, the government, the House GOP, Donald Trump, Elon Musk, none of them are in that room with you. This is between you and medical advice. And what we have seen in the first few weeks of this administration, and thank you, Senator, for showing what it means. They have purged the reproductive health resources from the HHS website. And that may just sound like, well, a website's down. This is critical information. It is access to medical information, and it is dangerous, and it is dangerous politically as well as for the health of patients to have that disappear overnight. This administration has also ordered the FBI to stop investigating bomb threats targeting abortion clinics. He has pardoned dangerous extremists convicted of harassing pregnant women. The Republicans in Congress have voted to lock up doctors, and in trying to justify their actions, they have accused grieving mothers of conspiring with these doctors to kill their healthy newborns. Can you think of anything more outrageous? We in this country have been and should be a global beacon for freedom and dignity and access to health care. We should be a model for the world. And instead, what this bill shows, and the necessity for this bill, is that we are being taken backwards in that struggle for fundamental freedom. And with this bill, we're going to give our Republican colleagues another chance to decide. Will you stand with more bans and less freedom and less health care, or will you stand on the side of the American people? Thank you all for being in this fight.
Oh, that's okay.
Sarah Jacobs.
Well, hi, everybody. I am so honored to be with this amazing group of leaders up here. So I know that I have used contraception for a long time, from the birth control pills I used to address terrible cramps as a teenager, to the IUD I've relied on for years, to the Plan B that I've used at times when I needed it. And I would venture a guess, not to make any assumptions, that every single person in this room has used contraception at least once in their lives too. And I would venture a guess that that's the case for our Republican colleagues as well, because they don't all have 100 kids. This is normal, essential health care, but it's so much more than that too. Contraception puts the power back in people's hands so they can get what they want out of life. They can finish school, they can get a job, they can get promoted, they can go after their dreams. It's reduced the gender pay gap. It's empowered women to be the majority of undergraduate students and even outpace men at earning law degrees, doctorate degrees, and medical degrees. And I'm pretty sure that the people who voted for Donald Trump did so because he said he was going to address the cost of living. But instead of addressing the cost of living, he's ripping up our Constitution and making things more expensive. Because now, more than ever, we need the reliability of contraception access. It's hard enough to afford housing or childcare or college without adding another child in the mix, especially one you didn't plan for. That's why we're here fighting for the right to contraception for everyone, no matter what state you live in or how much money you make, to be able to make your own decisions about your own lives. So we will keep fighting to pass the Right to Contraception Act and protect all the entitlements like Medicaid that help expand access to contraception for millions of low-income people across the country. This administration is operating on chaos, confusion, and flooding the zone. But we know that speaking out and public outrage works. They want us to feel powerless, overwhelmed, and alone. But we're not going to give in to that. We're not going to let them win. We're going to keep speaking up and telling how contraception has impacted each of our lives, and we're going to show why access to contraception matters. So we need you and your voice now more than ever, and I know all of us up here are not going to give up the fight. Thank you. And next, Dr. Reagan McDonald Mosley.
Good afternoon, everyone. Thank you so much, Senator Markey and Representative Fletcher, and all of the members championing this bill for the opportunity to be with you here today, and thank you for your leadership. My name is Dr. Reagan McDonald Mosley, and I'm the CEO of Power to Decide, and I'm also a practicing OBGYN. At Power to Decide, we are dedicated to providing the information that every person needs to achieve their reproductive well-being. Birth control is an essential part of the well-being for my patients, their families, and their communities. It helps my patients to manage health conditions, to plan if and when to have children, and to achieve their career and educational goals. Not surprisingly, birth control is very popular among all Americans. And those attacking it are spreading misinformation and disinformation in order to justify their attacks, whether it's attempting to defund the Title X program, cutting Medicaid, or efforts to undo the Affordable Care Act. The attacks are relentless. And our senators and representatives today have lifted up the attacks on information that we rely on as providers every day to provide contraception, STI testing care, and high-quality contraception care. And all of these harms and attacks do not fall equally. People already facing systemic barriers, including people of color, people with lower incomes, and people who live in rural areas, face growing difficulties in accessing the reproductive health care that they need. These attacks on birth control also do not come in a vacuum. They are layered over broader attacks on reproductive health. And now we must add to that the very real threats we are seeing on our government agencies and the fundamental information and services that they provide, including reproductive health information and care. If policymakers truly mean what they say regarding their support for contraception, there is no clearer way to meaningfully demonstrate that support than by sponsoring and supporting and passing the Right to Contraception Act. It's the first step to ensuring that birth control is protected for people everywhere. In this perilous time, we must assert our fundamental rights, and we must not take anything for granted. At Power to Decide, we remain committed to ensuring that everyone has access to the information and the care that they need to make informed decisions about their reproductive health, and we are grateful for the champions who stand with us today in this mission. Thank you so much.
And next, we're going to hear from Claire Coleman, President and CEO of National Family Planning and Reproductive Health Association.
Sorry, Senator Markey, it's NIFRA, hello. All of you could save it. So delighted to be here representing the publicly funded family planning network all around the country. These are folks who work in municipal and state health departments and private not-for-profits in all 50 states, DC, and the territories. These are the folks every day who open the health centers, sit at the front desks, and welcome patients in, trying to meet them where they are. Good quality care comes when we focus on the patient in front of us, when we ask them about their needs and their values, and then we do everything we can to make sure that the healthcare, the contraceptive methods, the testing, the treatment that are provided to that person meets their needs that day. All of the notions of patient-centeredness are being undermined in this government right now. As I was coming over, and I so appreciated Senator Hirono holding up some of the national standards that clinicians rely on, as I came over today, on the Office of Population Affairs website, it's the website where the Title X Family Planning Program, all their material is, the Title X handbook has been taken down. The quality family planning standards that were first introduced in 2014 and were just late last year revised have been taken down. The grants policy notice, which tells us how to responsibly manage federal money, has now disappeared from the Office of Population Affairs website. Right now, folks in the federal government are doing word searches through Title X grant applications, looking for words like equity, because that's going to tell them that our providers are violating the new policies of this administration. I do want to be clear that every application for Title X was filed under a different administration and a different set of rules. So all of those applications complied with the federal policy as well as the underlying law, and now they're being hunted. And this data will be turned over to political appointees in the coming week so that entities that were complying with the law can be identified for further steps. These are folks in government and nonprofits who honestly, if they weren't working in our health centers, would probably be eligible for the subsidies in the contraceptive programs. They are being threatened with their livelihoods, in their communities, and to violate the care of the patients that they serve. It's unbelievably outrageous. And I can tell you this, I just came home yesterday from Texas. We were with our members. People are very calm. They have a real sense of purpose. They know exactly what they're here to do, and they are not going to back down. They're gonna see patients, they're gonna keep their eyes in front of them, and they're gonna continue to do the good care that they were trained to do and they believe so deeply in. So I wanna appreciate so much Senator Markey, Senator Hirono, Congresswoman Fletcher, sorry, the Democratic whip, Congresswoman, sorry, Miss Congresswoman Jacobs, sorry. You guys had to do NIFRA, now I have to do all the names. This Right to Contraception Act, we shouldn't have to be here. We have a federal constitutional right to access contraception. We have robust federal funding for contraception and sexual health, Medicaid, a lifeline for millions of people to get contraception and sexual health, and a Title X network that was born more than 50 years ago to make the best use of public health funds to care for people who need contraception. The fact that we have to stand here and urge people to support a federal constitutional right before it is yanked away is outrageous. And all I can tell you is that our folks around the country are gonna stay in this, they're gonna work for the patients, they're gonna keep in touch with the legislators who are championing us and standing by our side. And we are so deeply appreciative, we're all gonna need to stick together. Community is the way forward, and our community will never, never give up. Thank you.
Beautiful. Whoa. Claire. Yeah. Wow. Wow. And we're going to keep the revival movement going right now with Minnie Timaraju, the president of Reproductive Freedom for All.
I don't know how I'm going to follow Claire, but here's what I'll say. Claire and her members with NEFRA across the country are saving lives. Family planning providers are offering critical preventative care. Family planning providers who provide life-saving contraception are also the ones on the front line providing cancer screenings, right? And we've seen a lot of common sense go out the window in the last couple of weeks, right? And I'm just so grateful to the folks here for standing up for basic, fundamental preventative care. And if their opponents were so concerned, so deeply concerned about abortion, they'd be doubling down on contraception. Every single one of them who are anti-abortion should be co-sponsoring this bill. That would be the rational thing, right, Lizzie? She knows in her state, my home state, I used to live in her district, so point of personal privilege with Lizzie. Your colleagues are crazy. And they're hypocrites. More importantly, we can laugh, but actually right now, they're incredibly, incredibly dangerous. And the threats to contraception could endanger millions of Americans' health. So we are so grateful to Senators Markey and Hirono, Representative Fletcher and Jacobs for leading this bill. As always, the Whip Katherine Clark for being the tip of the spear in the House on reproductive freedom. You know, I wanted to say something about voters and what's going on right now, being completely against the will of the voters. We spent a lot of time on the trail together, talking to a lot of voters, and maybe the outcome of this election wasn't what we wanted, but one thing was resoundingly clear. Voters support reproductive freedom, and that is the full range of reproductive freedom. That is contraception, that is IVF, that is abortion care. 8 out of 10 Americans, and when those issues were directly on the ballot, voters, despite their political persuasions, voted for these issues, which is why we resoundingly won so many ballot measures and so many down-ballot candidates in states with really tough fights won. I caution our colleagues up here, their opponents, the Republican caucuses of the House and the Senate, to be mindful of that information. Donald Trump and House and Senate Republicans have no mandate to attack reproductive freedom. They have no mandate to do any of the things they've been doing in the last few weeks. We can't take our fundamental rights for granted, including contraception. We're only 3 weeks into the second Trump administration. We've already seen, as Senator Hirono painstakingly laid out, the CDC's website on contraception being taken down, and, as Claire just mentioned, attacking gender identity, diversity, equity, inclusion initiatives that were embedded in this work, that were critical, that we know actually help serve many more Americans with life-saving preventative contraceptive care. We also know that those hostile to abortion never intended to stop with ending Roe, and you've heard about that already. The same extremists are working harder than ever to roll back so many more fundamental freedoms, again, without a mandate from voters. The Dobbs ruling gave the green light to extremists to begin enforcing the bans, but it also sent a clear and terrifying message to Americans and to voters. Our freedom to determine if, when, and how to start or grow a family is on the line. And we've already heard about Justice Thomas's concurring opinion in the Dobbs decision, going even further, addressing Griswold. So that's terrifying. As if we're not terrified enough, we've got that to worry about, which is why the members today are standing up and moving forward this legislation. I just want to remind everyone also that these barriers to birth control, they fall hardest on those working to make ends meet, those who already face significant barriers to health care due to discrimination, including young people, LGBTQIA plus folks, disabled people, and people of color, all things I guess we're just not allowed to say anymore on the CDC website. But Republicans in Congress have shown their hand by refusing to sign on to this common sense legislation, even after they ran on promises to protect contraception and IVF. We called them out then. We're going to call them out now. We at Reproductive Freedom for All are committed to spending resources to make sure every American, particularly in these critical seats held by Republicans, understands where their member stands on these issues. The fight does not stop because the election is over. In fact, the work to hold these folks accountable begins and redoubles today. So look, now they're working hand in hand to install extremist anti-abortion leaders in the cabinet. We will not hesitate. We will not hesitate to block every single one of them. Thank you to our Senate champions for working so hard to do that. We urge senators to vote no on every Trump appointee who is responsible for implementing Project 2025. There's no time to waste. So we start with this bill, but there's a much bigger agenda at play, and all of it matters, and all of it impacts the livelihoods of our communities. So with that, I'd like to turn it over to my colleague, Gretchen Borschelt, Vice President of Reproductive Rights and Health at the National Women's Law Center.
Thank you, Minnie, and welcome everybody. It's glad to be here. I'm Gretchen Borschelt. I'm the Vice President for Reproductive Rights and Health at the National Women's Law Center. And I want to start by thanking Senator Markey, Representative Fletcher, Whip Clark, Representative Jacobs, Senator Hirono, all of the champions who are part of this effort to sponsor and move forward with the Right to Contraception Act. I really want to thank you for your leadership in sending a clear message that the right to birth control is fundamental and it must be protected. There are those who think that we are posturing and that we don't need to be here and the right to birth control isn't under threat. But we know that is not true. Extremists are targeting the right to contraception and contraceptive access. And you've heard already today a lot of the examples, the real life examples of that happening. But because it is so real and it's still not believed, I want to offer a few more. In his first week in office, President Trump signed an executive order rolling back efforts to expand access to birth control. Project 2025 takes aim at the Affordable Care Act's birth control benefit. And it's not just the president and his allies that are going after birth control. Extremists at the state level have been attacking birth control for years. They restricted birth control access for Medicaid enrollees in Indiana. They excluded emergency contraception in public health university centers in Idaho. And in 12 states, we have seen extremist state legislators block measures that would codify a right to contraception in state law. They've also moved into the courts. Extremist Trump judge in Texas has blocked young people's confidential access to birth control in Title X clinics. And attacks on birth control aren't just in the legislature or in courts. We are seeing it more and more in the public narrative. So we have social media, so-called influencers who are out there spreading misinformation and lies, saying that birth control is bad for you. And that's affecting people's use, especially when they can't get accurate information from the sources they trust, like the CDC and like the Title X clinics. They are trying to take away our access to contraception. We see these attacks for what they are. They are intentional, they are purposeful, and they are using the anti-abortion playbook. They are targeting, in particular, the communities that are already vulnerable, that already face barriers to care, like young people, like low-income people. They are trying to take away our access to the contraception we need. They are trying to chip away at the right to birth control so that they can eventually overturn it, just as Justice Thomas has said he wants to do. They are trying to control us, and they're trying to deny us our reproductive freedoms. But we will not let them. And I want to thank the members here today for making it crystal clear that birth control rights and access are our fundamental freedoms. We will not let them take that away. The National Women's Law Center is going to continue working with the champions here to improve access to birth control and to protect our right to contraception. More than 80% of people in this country agree that everyone deserves the birth control they want and need when they want and need it without barriers. That is our vision, and the Right to Contraception Act is a piece of getting us to that goal. So thank you for doing what you all are doing.
Great job. Thank you. Thank you. Questions? The fight begins today. Thank you all.
Thank you all.